Welcome back. This is Sharmee Divan here, and we are talking about how to cope with post COVID anxiety. So, last time we talked about the 5 finger holds, the Jinshin Jitsu finger holds, and I taught you how to do each of the holds. I hope that you have had some practice since yesterday doing those finger holds. Let's go a little bit deeper into what exactly anxiety looks like. So, here are some of the common symptoms of anxiety: elevated heartbeats, palpitations. You're not paying attention to your breath. Breathlessness without any explainable reason. So you're feeling breathless, but you've not climbed, a bunch of stairs, or you've not been running or anything of that sort. Just sitting is causing this unexplainable breathlessness. A sudden freezing or being gripped by fear or worry just before doing a mundane activity. For example, leaving your home, getting into a cab, going to the grocery store, stepping into any public places, meeting new people. Any of these symptoms can be anxiety symptoms. Feeling spaced out, ungrounded, or helpless at times. Having a disturbed sleep. Some of the physical symptoms could be bloating, weight gain, acidity, lethargy, etc. Today we are going to look at how else can we cope with anxiety. Now, being a mental health professional, I can tell you for sure that 99.9% of your negative thoughts do not belong to you. What happens is that we humans are like a sponge. Wherever that we go, we carry our energy with us. Now, sometimes you may have noticed that when you go out in the public, you start to feel kind of energetically vulnerable. What do I mean by this? When you are feeling energetically vulnerable, you feel it almost feels like you're exposed, as if you've not worn clothing, like you're feeling almost naked, but you are wearing clothes. So that is an energetic exposure, or feeling energetic exposed when out and about in public place. Now, here are some of very useful techniques that I have learned over the years and I have been teaching, that can help you with keeping yourself together when you are out and about meeting people. So, other than wearing your mask, keeping your sanitizer, in your pocket or in your purse, all those COVID precautions, here are some of the emotional precautions that I want to talk about. So, number one, like I told you, your thoughts, 99.99% of your negative thoughts don't belong to you. So it's kind of like having a package that got delivered, an Amazon package has shown up at your doorstep, and it does not belong to you, it doesn't have your name on it. Now, in a normal circumstance, most of us will just give it back and say that, भाई साहब ये मेरा नहीं है, ये किसी और का है, आपने गलती से यहाँ पे भेजा हुआ है. You return it and maybe it goes back to the person who it belongs to. At the end of the day, it's not really your lookout. Point is, you did not take the package, right? So the same thing is going to apply to your thoughts. How are you going to do this with your thoughts? You are going to, number one, acknowledge the thought. Acknowledge that you are feeling anxious. Yes, I'm feeling anxious. And just give yourself a reality check. Does this anxiety really belong to me? Now, if an emotion belongs to you, you feel very welcomed by it. You feel very comfortable with it. For example, love, happiness, joy. Okay? these are positive emotions, and these make you feel expansive. They open up your space, they open up your heart chakra, they make you feel good, you know. Whereas anxiety, depression, anger, sadness, these are emotions that don't really belong to us. So yes, it is important to acknowledge that yes, I have this emotion, and while I acknowledge that I have this emotion, it does not really belong to me. So I choose to return this to the sender with love and consciousness attached. Okay, every single time that you have a negative thought, every single time that you feel the feeling of anxiety, you are going to first acknowledge that yes, I'm feeling this way. Do not resist it. Resistance, if you take a rubber band and you pull it, I have a rubber band, and I pull it, and it will go to the maximum capacity, and at one point the joint will snap. Okay, or this crystal bracelet, if I pull it, eventually it will snap and the beads will disperse. So when it comes to anxiety, it's the same story. If you keep on and on resisting it, it will grow and grow and grow and grow and grow, and it will make you have a panic attack. It will make you pass out of anxiety, and that's a very common thing to happen. You don't want to get it to that peak only. You want to nip it in the bud. So you say, okay, I have this package. This package is called anxiety. We're going to personify it a little bit. So, but this anxiety does not belong to me. So number one, you're going to stop owning it. It's not your anxiety. It is anxiety. Okay. So this is my hair. This is my t-shirt. This is my phone. It all belongs to me. These are my eyes, my nose, my lips, my mouth, my voice. Everything is mine. This screen, it's mine. But let's say that I have something, for example, these AirPods. These AirPods do not belong to me. I'm going to return them to the person that they belong to, my husband. Okay, so similarly, you are going to return this anxiety, this negative feeling, not yours, remember. So you're going to disconnect, you're going to break the rapport. You're not going to hold on to it and say, this is mine. You can say, I have anxiety, but this anxiety does not belong to me. I have it. So I have this package, I have these AirPods, but these are my AirPods and these are my husband's AirPods. So they don't belong to me, so they go back to him. But like I said, you may not necessarily know who the sender is, and that is completely okay. Like I said, it's kind of like the Amazon package that you receive that does not have your name on it. It has somebody else's name on it, and you don't know who that person is. You just return it to Amazon. So the same rule applies to your negative emotions. You send them back with love and consciousness attached to the sender. Whoever the sender is, you need not know who the sender is. So this is what you're going to practice today, and I will see you in the next video. Thank you. This is Sharmee Divan here.
Help Talks are daily health related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.